Good afternoon. You are in the Senate Finance Committee. Today is Thursday, March 19th. This is a voting session for voting list number 14, and we are going to start with Nathan.
Hit the button. Up first is Senate Bill 385, which, as amended and shown in the reprint before you, requires the Secretary of Health to issue, publish, and distribute recommendations for immunizations, screenings, and preventative services that follow the generally accepted consensus within the scientific community and sound clinical guidance. So a pharmacist may administer a vaccination recommended by the Secretary to an individual who is at least 7 years old. The bill also alters health insurance coverage requirements for certain immunizations, screenings, and preventative services. Obsolete language related to the pertussis vaccine is also repealed. The bill takes effect July 1 of this year and applies to all policies, contracts, and health benefit plans issued, delivered, or renewed in the state on or after January 1, 2027. So the amendments, which are on pages 3 and 7, require the Secretary the amendment, first on page 3 requires the Secretary, prior to adopting a recommendation for a preventative service that is not an immunization and has not been recommended by certain federal agencies, must hold a 30-day notice and comment period, obtain specified MHCC analysis, and then cite the authoritative medical organization on which the recommendation would be based. And then also, on page 7 of the bill, you'll see that there is a change that explains that a carrier must provide the coverage described in this subsection for plan years that begin on or after the date that is 1 year after the recommendations by the Secretary are offered. I will say for the provision on page 3 related to the notice and comment period and MHCC analysis, this language was developed by the MIA and the Department of Health in response to some concerns raised by carriers, and the chair is offering it on their behalf.
So, that's okay. Nathan, this does not require someone to get a vaccine.
That is correct.
Okay, I just want to make sure that's clear. Did you have something, Mr. Vice Chair?
No, ma'am.
Senator Lamb?
Yeah, thank you, Madam Chair. Just a quick clarifying question for Nathan. Does this, the House version, I think, is past the House, is that correct?
My understanding is that these are the same amendments that are being considered in the House. Let me get the...
Has not passed yet, but this should align it with the House version, I guess.
Correct.
Okay. All right. Thank you.
Unless they take 4 amendments.
Right. There are no no movement on the House bill, and therefore no finalized amendments to consider or adopt. But I believe the proposed amendments over there are coming from the same source.
Senator Washington?
Maybe someone can answer this. What would MDH do to evaluate whether or not a certain drug is good to be used, to recommend it? What would they do? Like, what do they test it themselves? Do they go off recommendations from someone else? Like, what is their process?
So on page 2 of the bill in subsection B, it says that the recommendation that the Secretary would be providing shall be in accordance with the applicable recommendations of 3 specified authoritative medical organizations, and then take into consideration the applicable guidance from the Statewide Advisory Commission on immunizations, and then lists other relevant federal authorities.
Sure,
So to your question, so they're not going to test the medications, the vaccines, because these already are all approved by FDA, who does their own evaluation, their clinical trials run, et cetera, et cetera. So these are already FDA approved. This is really just getting at the guidelines of, if someone below a certain age should take it, or you should take it in this age range. the Medicaid, the vaccine's already been approved. This is really just the guidelines, and then also touching on the coverage piece.
What does the FDA do to, I mean, not the FDA, but doesn't the Federal Health and Human Services, I mean, do they make recommendations just off of the recommendations or the approval of the FDA?
No, so FDA only looks at safety and efficacy of a drug. And so if it's safe and effective, they will approve. FDA does not make a recommendation on coverage, nor do they make a recommendation on, I guess the administration, the guidelines. They will say that this is approved for ages, whatever to whatever, but the specific, time frame, those traditionally have been set by CDC, and they have a advisory commission on immunization practices. That's the committee that's been of concern lately because a lot of the members have been switched over.
Got it. Got it. So they have to, the MDH would review 3 recommendations from 3 different sources on whether to recommend a certain drug or not, or if it's recommended. Is that right?
It's probably more than, I think it's like, it's not my bill, but I think it's more than 3 sources because it's looking at some of these scientific groups, like the American Academy of Pediatrics, OBGYNs, family physicians. It's taking into consideration CDC, FDA. There's a body that sets certain standards called the U.S. Preventive Services Task Force. It's also an HHS, the Health and Human Services federal body. And then we are also setting up, I think, a state-based commission also to look at things. And so, so there's going to be a lot of input into this process, but it's not just based on one, body or organization.
Or person.
Or person.
Got it. Okay. Yes.
Senator Reedy?
I'd just ask about, first off, I don't know if, and it might be a question for Dr. Lamb. What vaccines has HHS removed or said are no longer allowed? I know they've changed some of the recommendations about whether children need certain vaccines at certain ages, like, the COVID shot or certain vaccines. The impetus of this bill, I understand it's concerned that, the people introducing the bill don't agree with the new health secretary and things he has said, or perhaps even some things he's done. But I'm just curious, as it relates to vaccines, what the change has been to spur this.
So at the federal level, because of some of the transitions that were made in members of the CDC's Advisory Committee on Immunization Practices, or ACIP, which has generally been accepted as the gold standard, ACIP, for example, made some changes to recommendations on vaccination for children for things like hepatitis A, hepatitis B, meningitis, something called the RSV, which is another lung-based virus, and move them from being a general recommendation for children to being only recommended for children at certain high-risk, strata. And so they basically made it more difficult to recommend to parents and children to get the kids vaccinated for certain types of conditions. And those are the guidelines that were changed.
How did they make it? So first of all, they didn't outlaw it. They just said maybe young children don't need some of these unless they're high risk. How did they outlaw it? How did they make it harder? How does that make it harder to recommend it?
It makes it harder because a lot of the coverage requirements are all tied to ACIP recommendations. So all of a sudden, if you had a parent that may not, that has a child that may not have a particular high-risk condition, previously ACIP had recommended that this, let's say, hepatitis A vaccine was be administered to all children, just a general recommendation. Now it's just for high-risk children. If your child doesn't fall into that high-risk category, there's a potential that it may not be covered by carriers.
But wouldn't a doctor be able to say your child is a high-risk child for the purposes of needing this vaccine? I, as the pediatrician, am saying your
You
child.
should only
because of
say
this
you're a
vaccine.
high-risk child if you actually are a high-risk child.
High risk to what, though?
There are certain other things that are
Other
enumerated
categories.
there. You know, they may have some heart condition
Sure.
or something else. Like,
Is it the contention that that is an incorrect ruling by the CDC?
I think there's a contention by a lot of medical bodies and other scientists that those changes were politically drawn changes by a lot of by folks who were put on the CDC's committee that were very vaccine skeptical. I think that was the concern.
The tinfoil cap.
There you go.
Well, it's just the CDC. The CDC made a lot of promises about the COVID-19 vaccine, and a lot of them turned out to not be correct. But they still kept recommending that people all get it as young as babies. So why is this? Why is what's happening now different from that? You could say they were incorrect or they made a mistake or whatever, but they never really would come out and admit they made a mistake, but they did. But why is this different now than that?
I mean, I don't think I don't think they made a mistake, but B, you know, this is way broader than one vaccine, right? This is what was the gold standard body making recommendations and guidance across the board for all of these different types of vaccines, not just COVID, but things that are fairly common like RSV that have landed millions of kids in ICUs, to things like hepatitis A, hepatitis B, things that we generally accept as not wanting kids to get. Measles.
Have they said you should only get the measles vaccine if you're high risk? I don't think that's been said.
There have been so many changes to vaccines, I would need to look up measles to know what they've done to that. But
Let me ask one other question. It could be for the senator or for council, I guess. We're listing things that people we're going to listen to. Recommendations made in accordance with the applicable recommendations of the following authoritative medical organizations, but we're listing 3 organizations at least that are advocacy organizations. American College of Pediatrics is an advocacy lobbying firm. Now, I'm not suggesting they don't have good intentions or that their aims are not good, but they, and as far as I can see, the Academy of Family Physicians, and I think the College of Obstetricians and Gynecologists, although I didn't look that one up, but I know the Academy of Family Physicians and the Academy of Pediatrics, they lobby. They are advocacy organizations. So we're putting an advocacy organization by name in law, talking about how they're going to have some power over what vaccine recommendations we do in the state. Is there a concern about that? Setting up our own commission is one thing, but like you're saying them in addition to our commission, not they get a seat on the commission even, but that's who we're going to.
Well, I mean, to Senator Washington's point, there is no one single entity or agency that's going to be the one determinant, right? So they're taking the input in from these organizations. These organizations are kind of the authoritative specialty bodies for family doctors, for pediatricians, for OBGYNs. And, you know, it's no different than like AAA, where AAA has lobbyists that advocate for road safety, right? And so their positions are based on, they have their own process that they go through that's evidence-based and scientific-based to come to their policy positions that they do support. They also have their own guidelines. They have their own internal committees that will make recommendations on vaccines, on treating, you know, preeclampsia for women, for, you know, labor and delivery practices, et cetera, et cetera. You know, they have their own scientific bodies within each of these organizations to issue their guidance too.
But yes, I get it, and I'm not disparaging the organization. I'm saying, just like we don't put AAA in the law about how we decide to do our road policy, and put them on a commission and say we're going to listen to AAA.
But we put other organizations in the law. You know, we've sometimes said you need a representative from MedChi or the Maryland Hospital Association or someone representing
As
carriers.
part of a task force, yes, but we don't say we're having a task force, which is what we're doing with this health. We've got the Statewide Advisory Commission on Immunizations, and we're also going to equally weigh the American Academy of Pediatrics and the College of Obstetricians and the Academy of Family Physicians. And again, I'm not attacking those 3 groups. I'm just saying we're putting them in law that they're going to be the ones that we're going to weigh at the same level we weigh the CDC and U.S. health agencies?
I mean, that's probably better, right? That you have more sources to be able to draw the data from, right? So you're supposed to take into consideration these various, medical groups. There's a statewide advisory commission on immunization, CDC, FDA. You're actually taking in a lot more input into developing these guidelines that the secretary will promulgate out.
Okay.
Than even what we currently have. Right now, I think the law, and maybe counsel can correct me, I think a lot of our law is pegged to ACIP, is actually pegged to the CDC's advisory committee, just that one committee, because it was the gold standard. We just pegged everything to that and just said, that's fine. Now we're saying, let's take in more input from other sources too.
They weren't a part of that, right? These groups are not a part of CDC's about ACIP, right?
No,
They don't have, right? Okay.
No.
Okay. All right. Okay, thank you. Thank you, Madam Chair.
Welcome. Senator Mounts.
Thank you, Madam Chair. Just a quick question. I think I should direct it probably to Senator Lamb. Would that be okay? If I have a question for Senator Lamb about this, is that okay? Yeah. And this is, immunization schedules and recommendations. The CDC, I believe, also relies on international standards when they do this. This is sort of what I've read about some of these decisions. I was just wondering, if we're going to have the state, I'm probably voting against the bill, but this goes forward, there's no international consideration in what we're recommending in Maryland. Is there a reason that that's not included?
You want Maryland to consider international standards?
Well, I think that CDC currently does, don't they?
I don't think they do.
Or that would have been the appropriate question. Do you know if the CDC incorporates international standards when they implement their vaccination?
I don't think they weigh international standards. So one, vaccines that may be approved, vaccine approval is like country specific, right? And so, vaccine approved here may not be approved there, or approved there may not be here. And so there's some differences there. And so they have to go by really country specific. So the CDC just goes by what FDA is approved as a vaccine and bases the guidelines on that. Now, some of these studies that they may be looking at, there may be international components of a study. They may be studying, this vaccine being administered to 10,000 people, and maybe one arm of the study is foreign-based and the other arms are here. But they're really making their decision primarily on what's here, not on foreign-based standards and recommendations.
I was just interested to know about that, so thank you.
Sure.
Senator Kyle.
As Madam Chair often says, I did Google it. And it looks like the CDC does review guidance and data from organizations like the World Health Organization, as well as vaccine schedules used in other countries, and it helps inform their best practices, emerging evidence, and global disease trends. So they do look at other things, some things, including the World Health Organization.
Thank you, because that's where my question was derived. However, it was rebutted.
I don't have any other answers, just so you know. So if there's a follow-up, I got nothing else other than asking the Google machine.
Dr. Google, of course. But just to be clear, the medications may be approved differently in other countries. Just because it's approved for, the formulations may be different, the ages may be different, so they have to take those things into account. It's not just carte blanche, take what other countries have done and insert them into ours.
Thank you, Vice Chair Rabbit. Favorable. Do I have a second? Second, Senator Kramer. All in favor of Senate Bill 385?
It's a party.
Senate Bill 385, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
No.
No. Senator Mounts.
Yes.
No. Senator Jackson. Yes. Senator Washington. Yes. Senator Guile. Yes. Senator Lamb. Yes. Senator Hershey.
No.
No. Madam Chair? Yes. Yes, 7-3, the bill passes.
Senate Bill 387 is an administration bill that, as amendment, prohibits a food retailer or a third-party delivery service provider from engaging in dynamic pricing to increase or using personal data to increase the price of a good or service for a single consumer. A food retailer or third-party delivery service provider may not use protected class data to offer, advertise, or sell a consumer good or service to a consumer for whom the protected class data pertains if the use of such data has the effect of withholding or denying from the consumer an accommodation, an advantage, or a privilege provided to others. In violation of these provisions is an unfair, abusive, or deceptive trade practice under the Maryland Consumer Protection Act, subject to the civil penalty provisions only. You do have a reprint, and co-counsel Nathan has passed out just a single page of the reprint with something circled. That language is different in the reprint that I had annotated earlier, so I will address that when we get there. Okay, so page 1 represents technical amendments. On page 2 of the reprint, we're adding a definition for consent as it is used here, and it cross-references to the commercial law articles definition section. The definition of dynamic pricing has been altered to mean the discriminatory practice of offering or setting a personalized price for a good or service that is specific to a consumer based on the consumer's personal data, regardless of whether the seller collected or purchased that personal data. There are also a number of exclusions that were added for activities that consumers generally want retailers to be able to undertake, like sending coupons or loyalty programs. It also adds exclusions for valid reasons retailers may increase prices, such as the cost of obtaining the goods, or where the price is different based on locations or geography, differences in supply or demand, those sorts of things. At the very bottom of page 2, the definition for surveillance data is struck. And then at the top of page 3, a definition for personal data, also cross-referenced to the definitions section in the commercial law article for personal data as a replacement term to surveillance data. And then there's a definition added for third-party food delivery service provider, and the bill then applies to a third-party food delivery service provider. Now at lines 5 through 7, that's where that insert that Nathan was passing out comes into play. Here, just to make sure, to make it amply clear that the prohibition only applies in case of increasing a price, the page that you see just tabulates out subsection B into paragraphs 1 and 2, prohibiting a food retailer or third-party food delivery service provider from engaging in dynamic pricing to increase a price for a specific consumer, or use personal data to increase a price for consumer goods or services to a single consumer or group of consumers. And then subsection D, that is new, establishes a right to cure. Subsection E explicitly disallows a private right of action. Section 13408 is included to explicitly say that it does not apply to the provisions in this act, and that subsection 13408 is the private right of action authorization under the Maryland Consumer Protection Act. And then on the next page, page 4, but has no page number at the top, includes subsection 13411, also to exclude the criminal penalty provisions and make them inapplicable to the bill. Finally, the bill strikes all labor and collective bargaining provisions that were originally included, and it strikes the bill as an emergency measure on the final page, page 404, designation, and establishes a October 1 effective date. These amendments are a result of compromise amendments negotiated with many parties, including the administration, who sent me a reprint, and then more amendments with stakeholders and all of these amendments here are a result of that and are offered by the chair.
I don't know where to start. Senator Mounts?
Thank you, Madam Chair. That was a lot. Thank you very much for all your work. The penalty provisions, there was a criminal penalty, I think a private right of action. How?
Those are both only included in the bill to say that they don't apply to this section of law, so they will not apply to the bill.
Okay, so they're not in the bill.
They are not in the bill.
Thank you.
Senator Gall?
And just follow, so to be clear, then the only enforcement mechanism is through the Office of the Attorney General, Consumer
It's a civil
Protection
enforcement.
Division?
Yes.
Oh, it's a civil enforcement through the Office of the Attorney General?
Yes.
As administrator. And I'm sure everybody's getting calls and et cetera about this, but is the definition of baseline price included within the bill?
It is not.
Okay. Okay. All right, thank you. Thank you, Madam Chair.
Senator Washington?
Thank you, Madam Chair. Can you just briefly explain private rights of action, just briefly, because I know just for the public, and also why we remove it from this bill?
Sure. So, Senator, a private right of action allows any citizen to who has been harmed under this provision of law to file, or would if it applied to this bill, but if they're harmed by provision of law, to file a lawsuit and pursue their own relief. The reason that the committee often removes and has removed from this bill the private right of action is it tends to, as those judicial resolutions come about, create a piecemeal of judge-made law interpreting the bill rather than larger cases that are pursued and brought by the Attorney General, which would apply statewide.
So under this bill, it will have to be a collection of Maryland residents that feel to ask the Attorney General to file a
So
lawsuit.
normally how consumer protection claims work is an individual can still make a claim with the Consumer Protection Division of the Attorney General's office. The Consumer Protection Division then reaches out to that individual to first try to negotiate some kind of settlement to resolve the issue. If that can't happen, then these next steps take place. If the Attorney General finds that there is enough violation or complaints against a specific violator or a specific allegations of violations, then the Attorney General would bring case against that because they've had so many complaints.
The governor introduced this as private rights of action, right?
I'm sorry?
The governor introduced it to have private rights of action in it?
Yes, it did have a private right of action as introduced.
Got it. And the committee is stripping that out, right?
That has been, as the
Proposed.
amendments presented, yes.
Correct. And the Attorney General's office, did they make an opinion on that matter? To say they have enough staff to be able to implement this if there's thousands upon thousands of people that want to make an issue of this?
Give me just one moment, Senator, just to look up their specific testimony. I do not believe it references their staff, however. They were supportive of the bill generally, but recommended that certain definitions be cross-referenced. They did not, but I did not consult them, the reprint that came to me and the amendments that came to me from the governor's office already had the private right of action out, so that was negotiated between the administration and stakeholders. And I did not consult with the Consumer Protection Division or the Office of the Attorney General on that amendment once I had those from the governor's office.
Thanks for that clarification.
I will tell you, Amber has worked extremely hard on this bill, and we thank you for that. Vice Chair Hayes?
Thank you, Madam Chair. For the definition, I know there was some conversation with, does it only apply to increases in prices or?
Yes, Senator. Let me dig into that, and thank you for the question because it's important that everyone understands how this is working. So the definition for dynamic pricing does not include the word increase because the practice of dynamic pricing is really about setting prices up, down, wherever, based on sets of factors in the retail environment. What the bill is prohibiting, though, is using dynamic pricing then to increase a price. We, or the committee heard testimony about not wanting to limit the ability of retailers to offer discounts, targeted coupons, those sorts of things. So that's why the prohibition applies to increases. It's just not included in the definition because that's not what dynamic pricing is.
Because absolutely, if there's opportunities for consumers and our constituents to save, we will want to allow for that to happen.
Correct.
Gotcha. Thank you, Madam Chair.
Welcome. Go ahead. Senator Lamb.
Does this bill only apply to in-person grocery stores?
No, it applies to the food retailers as introduced, but it also applies to the third-party food delivery service providers, which is a merchant that provides as a consumer service the delivery of food and is not otherwise a food retailer.
And then, I think I know the answer to this question, but I know the grocery store workers were concerned about those digital signs, and that may be a provision in a different bill. I'm assuming there's no appetite to include that in this bill, right?
Correct, Senator. I did not, it is not in this bill. There was conflicting testimony about ESL, so we kept this just on dynamic pricing.
Right, so there's no ESL,
Nothing touches ESLs in the bill.
okay.
Move favorable.
Thank you, Mr. Vice Chair. Do I have a second for the favorable on 387? Second is Senator Guile. Let's call the roll, please.
Senate Bill 387, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy. Pass. Senator Mounts. Yes. Senator Jackson. Yes. Senator Washington. Yes. Senator Guile. Yes. Senator Lamb. Yes. Senator Hershey. No. Senator Reedy.
I'm gonna vote no for now. I'm not changing it. I'm gonna leave it more.
No. Madam Chair.
Yes.
Yes. 8-2, the bill passes.
I just want to mention, in a recent consumer poll, this is one of the top concerns from consumers. One of the top, yeah.
They don't have any of those.
Well, right about in that order. Yeah, right in that order. Okay, thank you. So that was a 7-3, Tammy? 8-2. Let's see, Amber, Senate Bill 455.
Thank you, Madam Chair. Senate Bill 455 establishes a transformational project financing program and related fund within the Department of Housing and Community Development to support development districts that have a transformational plan as defined in the bill and for which the local governing body has an approved tax increment financing plan before July 1, 2031, and pledges certain real property tax increment revenues. A state-supported development district is eligible for an annual disbursement of net new state revenue attributable to the district as determined and certified by the comptroller. You do have a reprint, but the amendment just throughout changes Medco, who, as the bill was introduced, was going to administer the program, to the Department of Housing and Community Development as the administering agency. And this is something that's supported by the Department of Housing and Community Development. We do have a letter from their secretary, Jake Day, here, supporting that. I do want to note for you from the State Treasurer's Office, while they are neutral on this bill, They do want the committee to he does want the committee to understand that the pledge of state tax dollars under the bill invites the potential for the debt issued under the new program to be counted as state debt by rating agencies. This could be the case even if the law itself were to explicitly state that this is not state debt. Such a determination could impact debt affordability as well as the state's credit ratings. There is no one amendment or set of amendments that the Treasurer could propose that would guarantee that this new kind of debt would be considered separate from state debt. But it is within the committee's, authority to determine if they want to make that decision and use this kinds of financing.
Senator Reedy.
Oh, okay, I'm going to defer to my vice chair. So this is something, I'm listening to the letter from the comptroller, which sounds.
The Treasurer's office.
Treasurer, I'm sorry, the treasurer, sounds ominous. We also have a looming, there's a looming issue with lawsuits that'll need to be settled at some point. And that may be, I'm not saying this related to this bill, but if this is creating an obligation, it just sounds a little concerning. I'm not quite sure what this is even going to do, but it's concerning. Please.
So just to sort of address that, this would apply to net new revenue. So if there are no new projects, the state is not getting that tax revenue already. But if there is a new project, then this authorizes, as part of the funding mechanisms, to retain some of those taxes for bigger projects that that would otherwise not be undertaken without this funding mechanism. If that is helpful, I don't know, but
well, I guess what is his point is the point of the bill, like if we get a big project in a particular area of need, we can take a percentage of the tax revenue that project engenders or generates and hold that aside to further invest in that area? Or am I not understanding the bill?
Or to recoup funds already outlaid to start the project. That's what the.
But don't we do that anyway when if Commerce negotiates a tax credit package with an entity for development? I'm just.
That would be contract to contract. This authorizes a project and codifies a project is all. And this would not be under MEDCO. It's under the Housing and Community Development. Yeah.
Okay. I'm just, all right.
Okay. Vice Chair Hayes.
Yeah. In the beginning of your explanation, Amber, you had stated a date. And I think you had alluded to that it had to have a plan prior to that date.
Correct, Senator, and let me find that in the bill so I can address it specifically. Sorry, Senator.
It was like July something.
Yeah, they have to have a certain local plan approved by that date, but I'm having trouble locating the provision. I'm sorry.
Yeah, I couldn't find it myself. That's why I'm asking. I heard the explanation, but I couldn't locate where it was.
Sorry, it's on page 5 of the bill under 12-2A03.
12-2, okay, 03. Going back, so as
That's
long
for
as they
Baltimore City, yes.
okay, so if they have a development plan prior to July 1st, 2031, what is the purpose of that? Is because there's no sunset on the bill, right? So would this end at a certain period of time?
I think that is specific to the Baltimore City Charter, but I can look into it further for you, Senator. I don't know the answer.
Okay. And also, the bill is authorizing the use of, and that, the part of the information that the treasurer's office has presented to us is the fact that they're using a sales tax?
They have the opportunity to use 3 different forms of tax revenue, state revenue, and that would be the income tax, sales and use tax, and other state taxes that are designated as being attributable to the state-supported development district.
Gotcha.
They would be designated by the comptroller for clarity.
And is the purpose of those to pay back the bonds? The purpose of using those taxes is to pay back the debt that would be owed on
Yes,
the project?
Yes.
And is it confined to that area, or where would they abstract those
It would-
taxes from? Is it confined only to the area of
yes, it
sales
would
taxes
be
that
in the
generated
state-supported development district.
state?
And that is defined in the bill to mean the development district that has the transformational plan. The transformational plan basically would lay out how it qualifies and what area, the development district that it applies to. So the specific area isn't defined in the bill. That would be part
Right.
of developing the project.
And so it sounds like this is similar to a TIF, but called by a different name, right?
It is a TIF.
And is there any involvement of the local government in identifying what that
Yes.
designated plan
Yes,
would be?
there is. Not too much paper here.
Baltimore City supports the bill.
The local governing body has to have the approved tax increment financing plan, and they have to pledge the property tax. So the local governing body has to,
Would that be the Board of Estimates or the City Council?
I don't know.
Isn't the governing body?
It depends on what it is. Sometimes, so only the Board of Estimates can bind the city to contracts and expenditures. But the City Council has a different set of powers and responsibilities there too. I'm not clear about.
In my county, it's the county council.
Yes, sir. Gotcha.
You wanna
Okay.
hold it until you get some answers?
Yeah, let's just hold it.
Just till tomorrow.
Yeah, that's fine.
it.
Yeah,
Okay.
I mean, I think it's a great way to have development. It's just those details that I just wasn't sure about. So we'll hold it.
We can hold till tomorrow. Fine. Okay, Amber, your last bill is 753, fiduciary sunken exploitation of seniors and vulnerable adults.
Okay, Senate Bill 753 authorizes a fiduciary institution to delay or deny disbursements from an account of a senior citizen or vulnerable adult if the fiduciary institution reasonably suspects the disbursement will result in the financial exploitation of an eligible adult. It includes notification requirements and provisions for the extension and termination of the delayed payments. There are no amendments, there's no fiscal impact, there's no opposition at the committee hearing.
There was no opposition?
There is no opposition.
Can I have a motion favorable? Senator Mass? Who's seconding? Senator Reed. My goodness, minority party motion and second?
On Senator Kramer's bill.
On the Kramer bill. This bill must have gotten lost in the pile.
First non-collectible.
We heard it late.
We heard it late, okay. So, all in favor of Senate Bill 753, going to help these old people who, there we go.
Season.
Unanimous vote, thank you. Okay, now we're up to Lisa.
Okay, Senate Bill 435 again.
John. John.
We are 435. Okay, as amended, it establishes methadomazine and xylazine as Schedule III controlled dangerous substances under the Maryland Controlled Dangerous Substances Act.
Senator Lamb has his light on.
Yeah, thank you. I don't think we got a new copy of this, right? This is still the same as?
It's still the same. Read
Okay. I don't have yesterday's copy on me, but I think in summary, this just moves these two medications to Schedule III, makes it a criminal. There's some criminal penalties here. Yeah. And so the body of the bill was essentially taken out. It was these two medications were added to Schedule III. There are criminal penalties now. I think this bill is very different than what we heard, right? And so if you look at the advocates in the bill folder, they were all very supportive of the original bill as drafted. Now, the way this is reconfigured, this is almost like a criminal justice bill that, you know, it hits on the criminal code for any violations of this. I do have concerns about that. You know, I'd be interested if ordinarily this stuff would go to JPR. It's now ending up here because of how this has been amended. Well, I guess, sorry, it would, if this was how it was drafted originally, it probably would have gone to JPR. It's here because of how it was originally drafted, but now it's been basically gutted and re-amended. So I do have some concerns about how this hits and with the considerations and also where the advocates are, because I think they probably all switch sides now, that like the folks that were originally for this bill are now probably very concerned about this bill, and vice versa. Would, you know, be interested to see what folks maybe on JPR might say about the criminal justice, the criminal provisions here, the criminal penalty provisions here. And the House bill is already over here, I think, too, right? So the House bill is sitting before this committee. There's still time, right, for us to sort this out.
Excuse me, Senator, is the House bill amended to this?
Mm-hmm. Yes. So we have the House bill in this current posture.
Yeah, the House.
Could they send the House bill the way it is now to JPR?
I'm not sure procedurally how that would work.
Could you re-refer it to JPR? I think Senator Washington asked to hold the bill, but I'll second that.
We held it yesterday.
We'd have to.
You,
I don't record who holds, I just need to know that someone is holding it.
Well, is there a way for us, I mean, it passed the House like unanimously. That doesn't mean we have
But you understand that it changed so significantly that it should have been in a different committee. If it had come in this condition, it would have gone to JPR. That's the question.
They send us stuff to fix.
It struck the whole bill and put new language in.
and if
We have the
because the
cross
House
file, I'm
bill
pretty
is already
sure.
over here, we can have the House bill hearing after crossover and essentially have the bill hearing on this version of the bill, which is very different than the version.
And then
that we
pass
heard
both
first.
bills.
I do want to
Or not, but
Or not.
whatever, yeah.
I mean, you
This
know,
is JPR bill, which I'm
okay.
Look, so I do want to say, there's veterinary groups that are now support the bill. So there was opposition removed with the bill. Now, that doesn't speak to the criminal nature of it, but, I mean, don't we want a criminal penalty if somebody's possessing a Schedule III dangerous substance?
I did email one of the advocates who had reached out, who had originally supported the bill, and then it's NCADD Maryland. I'm not totally sure what that stands for, but they had supported the bill as it was originally introduced, and now they're concerned with the fact that this is basically establishing criminal penalties for additives rather than drugs that people are using as like heroin or something that is psychoactive and get them high. And I think that's the distinction, is they're worried about increased incarceration and drug penalties for things that aren't really bought over the counter or even bought commercially to begin with, and that people aren't getting high on, I guess.
Well, it's something they're using to make the drug more potent, so.
Yeah, and I guess in that sense, yes, I guess their distinction is the fact that it's an additive and not being used as a drug on its own, like a lot of scheduled drugs are. like if you just take xylazine on your own, you don't feel anything, but if it's being added to psychoactive drugs.
Did the bill originally have criminal penalties?
No, it just had a pretty comprehensive scheme of the steps you had to take, and was more of a burden on retailers as far as documentation and verifying age and everything. NCADD stands for the National Council on Alcoholism and Drug Dependency.
Okay.
So Senator Lamb, you asked for hold it, right?
We're getting to where we're holding bills more than once.
Okay. Senate Bill 469, as amended, authorizes the Maryland Automobile Insurance Fund to establish an affordability program. There are 2 amendments. Amendment 1 is technical, and Amendment 2 alters the allocation percentage of an assessment issued by the fund and establishes requirements and limitations for the affordability program authorized under the bill. These amendments were worked on with the sponsor, MIA, and MAIF, and they've all come to a consensus on the bill as amended.
Everyone's on board.
Second?
You made everybody happy?
They made themselves happy.
Everybody but the chair. I have a motion favorable. Do I have a second?
Second.
Senator Guile. Okay. Do we want to, all in favor, or do we want a roll call? All in favor of Senate Bill 469?
Everybody's happy.
Senator Washington, you okay? Okay, unanimous vote. Okay, Senate Bill 546.
Senate Bill 546 establishes new requirements regarding labeling of food items and milk products for human consumption and prohibits the sale of items labeled with a sell-by date that do not meet such requirements. There are 2 amendments. Amendment 1 strikes provisions of the bill relating to milk product, extends the date by which a person must comply with the provisions by 1 year, and provides an exception for a food retailer that is selling an item that does not comply with the Act but was purchased before the enforcement date of the Act. The amendment also strikes the requirement that the Maryland Department of Health develop an educational program and instead requires the department to create educational materials in conjunction with the University of Maryland Extension and food donation organizations. That's Amendment 2. Amendment 1 was technical. The bill did pass the House with the same amendments.
No.
Not unanimous.
Do you understand what the bill does?
It's about putting the labels on food to be consistent, like with how they have the best by date and the sell by date and everything. It's setting up a consistency scheme. So by 2028, they have to use the best if
One or
used
the
by
other.
to indicate quality date of the food and user freeze by to consider to put the safety date of the food.
Got it.
Yeah.
Yeah, how much stuff we're gonna label? We're gonna have to get bigger labels in this state. Labeling soda.
Is this something that can be done for just, is this something that can be done for just Maryland? Is that,
Yeah, they have until 2028. The bill originally was until 2027. I believe it was just prepackaged food. Yeah, I guess it would have to be, I mean, if they wanted to sell it in Maryland, they would have to comply.
Madam Chair, what is the appropriate motion here? I don't. Madam Chair, I have real concerns with those types of regulations that we put on national and multinational companies to bring their food products to the state of Maryland. It seems a little bit overreaching to try to make them do something that probably in a sense they're already doing a lot of already.
Thank you, Madam Chair. I have some similar reservations. did ask the Google machine. So, but like, and maybe council can provide some additional insight, but I'm not seeing that any state does this, require expiration or best by dates. Has any state done this?
I don't believe so.
So, I mean, I just feel like we might be making it harder. I mean, there's things that I like the concept of this, right? But it's my understanding that manufacturers, people do this voluntarily, and I think only for like infant formula is it required, and now we're going to require it for. How are they supposed to comply? And is it going to make it more difficult for certain manufacturers and suppliers to have products here in the state of Maryland?
Yeah, according to the fiscal note, there's no uniform national standard for food labeling, but the USDA and FDA encourage retailers and food manufacturers to use a best if used by date.
Okay. And I mean, unless you know otherwise, I'm not seeing that any other states have specific laws on this.
Yeah, it says several states, including Maryland, have their own regulations to food guide labeling, but I'm not sure if those would encompass.
As broadly as what this would
Yes.
require. Okay. All right. Should we?
So what does this actually mean? Does it say best if used by? Is that what the?
So I think the sponsor's intention was to standardize it because we have all these dates that go on food products and it's not totally clear. Is it safe to eat after this date, or does this just mean the quality might not be as good? So they're trying to standardize that there's a certain date on the food that says best if used by to indicate the quality date. And then used by or use or freeze by indicates the safety date of this food is not safe to eat after that date.
Next bill.
I don't see a motion. Senator Ryan?
Oh, no, I'm not.
Okay. You want to do your next one, Lisa?
Sure. So this one, I just got the reprint done while we were sitting here earlier, so Nathan is distributing that. These are amendments put in by the sponsor for Senate Bill 608. And Senate Bill 608 requires certain insurers, nonprofit health service plans, health maintenance organizations, and Medicaid to provide coverage for single gene and multi-gene pharmacogenomic testing under specified circumstances. As amended, the bill strikes some provisions that were in there that kind of varied from how health insurance mandates usually are structured. So in the beginning, it simply applies the coverage requirements to managed care organizations. On page 3 is the requirement for Medicaid, and then further down is the requirement for private health insurers, and on the bottom of page 3 onto page 4 is new criteria that's been put in the bill to establish what situations the carrier is required to provide coverage in. And then at the end, the only other change is also to make it consistent with other health insurance bills is applying it to contracts issued after January 1st, 2027, and changing the effective date to January 1st to align with the plan years.
Senator Mouse?
Thank you, Madam Chair. This is the second year we put this bill in. I want to thank stakeholders for the amendments to help make this a better product. There was one particular line that was suggested just to make sure there is coverage. Was that included in the reprint, or is that still outstanding?
It's on page 4, it's item 6.
The pharmacogenic test is covered by federal Medicare program under national and/or local coverage determination.
This is where they test to see what medication is the best for your, it doesn't guarantee it, but it's a place to start.
Yeah, like if people have genes that make them metabolize certain drugs quicker or slower.
Do I have a motion for Senate Bill 608?
I'll move favorable.
Senator Mouse, do I have a second? Is there a second for Senate Bill 608? Senator Lamb? Okay.
Can I ask a question?
Yes, sir.
Did we get a letter from the asphalt contractors as to whether they like this bill or not? Because that's where I get my guidance in voting on bills, so I was just curious, maybe they weighed in on what their thoughts are on this bill. Did we get such a letter?
Not commented specifically, however, many of their members may actually benefit at some point from the coverage.
There you go. All right, thank you, Madam Chair.
Thank you. We have a motion and a second. All in favor? Should we call the roll? No. It's a unanimous vote. Thank you. Okay, we're going to skip 623 and then come back to it. No, we're going to do it today. We're just going to do the next two bills first, next three. Okay, Senate Bill 739, Senator Kramer's bill.
Okay.
Guess we gotta find out if the asphalt contractors.
Senate Bill 739 requires the University System of Maryland to conduct a study to evaluate the relationship between climate change, the availability and price of homeowners insurance, and emergency and disaster preparedness. There's one amendment. It adds a representative of the Independent Insurance Agents of Maryland to the individuals conducting the study, alters the deadline for the study, and authorizes up to $150,000 of the Strategic Energy Investment Fund to be used by the University System of Maryland to conduct the study.
Did we push back the date to July 1?
Yep.
Okay.
And now we're okay with B&T. We sent B&T and they gave approval. All right.
I was going to say, we haven't completely drained the C fund yet. I mean, do we know that there's $150,000 in it for this?
Is it left?
I don't know. I was also concerned with a Southeast Conference school like UMD, do they actually believe in climate change down there?
I think we gotta ask the asphalt.
Ask the asphalt contractors. Did we pass collective bargaining for them yet? I mean, are graduate assistants, are they all on board? Is the University of Maryland on board with this? I mean, do they say that they're willing to do this?
The university did.
They did?
They actually said they would do it with, and then said, it would be nice though if maybe we got a small amount of money, which is where the request for the CEF, and by the way, that's exactly what the CEF is intended for.
For very prescriptive studies on climate change and the studies and the damage it's doing.
I would move favorable, Madam Chair.
Senator Hayes, let's call the roll.
Just for fun.
Senate Bill 739, favorable with amendment. Vice Chair Hayes? Yes. Senator Kramer?
Yes.
Yes. Senator Reedy?
No, but in explaining my vote,
Nobody's interested.
I would vote yes if they would also include a study of how all these politicians and actresses and actors that think the world's going to end in 10 years still keep buying stuff by the ocean and the sea. That would be a fun thing to study, but no for me.
Senator Mounts?
I'm a no for the graduate students.
Are you a yes for this bill, or you're a no?
I'm a no.
Senator Mounts, no. Senator Jackson? 739, yes. Senator Washington? Yes. Senator Guile? Yes. Senator Lamb? Yes. Senator Hershey?
Another ratepayer-funded study. Nope.
No. Madam Chair?
Yes.
It's to
Yes.
help the insurance
7-3, the bill
ratepayer.
passes.
You will get nothing out of this that will be useful. I assure you, right? What can come out of here that's going to be useful? That they did a study and determined that the weather changes?
Okay. Senate Bill 807. Lisa?
Senate Bill 807 establishes a statewide Class 10 farm distillery license that may be issued by the Alcohol, Tobacco, and Cannabis Commission only to a holder of a Class 8 farm brewery license. The bill adds, modifies, and repeals provisions related to a Class 8 farm brewery license consistent with a Class 10 farm distillery license and modifies provisions related to additional licenses. There are two amendments, which you should have a reprint for. The amendment limits the zoning exceptions in the bill and restores repealed language authorizing Class 8 farm breweries to sell or serve certain food items. It also removes the provisions authorizing a Class 10 farm distillery to serve products manufactured by another manufacturer and authorizing a Class 8 farm brewery to sell beer produced by another manufacturer.
Just the porta potties. Or what do you call the bathroom?
We've got a house toilet bill coming over too.
Let me be clear, I've done my toilet bill for the session, okay? Just somebody does.
That's true, I did.
No, you're floor leader for that one now.
Do I have a motion for Senate Bill 807?
Second.
Okay, should we call the roll, or do I have a unanimous vote? Senate Bill 807, unanimous vote, thank you. It's okay. It's fine. Okay, Senator 947.
Senate Bill 947 makes changes to the structure, authority, and responsibilities of the Maryland Transit Administration with respect to procurement law, oversight of MTA operations by boards and commissions, and tort liability. Additionally, MTA must contract with the Baltimore Metropolitan Council to complete a technical study regarding the creation of a rail authority as specified. The bill also proposes a constitutional amendment to authorize quick-take condemnation authority for MTA or a successor state agency, and clarifies that the authority applies to the State Highway Administration or a successor state agency instead of the State Roads Commission. Contingent on the enactment of the constitutional amendment, the bill also establishes procedures and processes that must be followed when by MTA when it seeks to condemn property for a transit purpose using quick-take authority, and modifies the related responsibilities for local boards of property review. There are two separate proposed amendments that conflict, so I think we could walk through them separately. The first set of amendments is from Senator Hayes. It says Hayes amendments on it. You should have a reprint. What this amendment does is it strikes the provision that exempts capital construction projects on existing and defined fixed guideway systems from Division 2 of the State Finance and Procurement article, and that's the division that governs procurement process. And then this is not in there because of the time limitations, but you intended to strike the tort cap as well? Yes, so on page 15, that would be struck from the bill as well, about putting the tort cap on $400,000.
Yes.
And then the whole constitutional amendment, which relates to the eminent domain and quick take authority of the board, is also struck from the bill entirely. So mainly, the bill is written is mainly the provisions about reorganizing the Baltimore Core Transit Service Board and establishing the Commuter Services Board. And the alternate amendment is the bill as it was passed by the House. In this bill, this is House amendments. So the structure of this is a little complicated. The first section of the bill, which goes until the bottom where it says 4-415, that whole, all of these provisions are exempting maintenance and capital construction contracts to support MTA's fixed guideway systems and associated transit facilities and vehicles are exempted from certain provisions of state procurement law. They're exempted from relevant provisions of that would require them to go to the Board of Public Works. And this whole section is contingent on a House bill failing. So if that House bill fails, these provisions are in place. If that House bill does not fail, everything in section 2 of the bill would be taken into place, and that would exempt those projects if they were below $500,000 of value.
It would exempt projects under $500,000.
Yes. And I think the House bill, as it is written, would exempt those dollar amounts, so that's why this is contingent. So I guess that would be happening under the bill either way, because either it would be, those provisions would be adopted by House Bill 587 or would be adopted under this bill. And then there were there were some technical and stylistic changes to the board overall, but then the end of this, yeah, not much else is amended. The amendments are mainly on the procurement provisions, as far as the House amendments are.
Yours takes out constitutional amendments. No, I was just, thank you, Madam Chair. I was just going to check, again, the differences and probably look a little bit more towards the vice chairman's amendments. I don't know how you're planning on handling the,
That's why I asked him his pleasure, because
yeah,
he's paid a lot of attention.
Right.
Let's hear some other questions,
Okay.
we'll come back. Senator Washington.
Thank you, Madam Chair. I wrote down a question. Does this bill create a new, you said there was a study to create a real authority? What is that? Is it, did you say real authority, or what was that?
Rail Authority.
Rail authority.
So I think it's an entity that already exists, but they're kind of reorganizing them and transferring them to a new entity. Oh, the constitutional, are you talking about the quick take authority, or?
constitutional amendments still allow quick take.
Yeah, no, they're, yes.
On his.
So the boards establish, it repeals the Baltimore Regional Transit Commission and then instead makes the Board of Directors for the Baltimore Core Transit Services and the Commuter Advisory Board under MTA instead.
So this doesn't have, thank you for that. So this doesn't have this is creating a new transit authority for Baltimore City. And I know that there's bills out there because I sponsored one to create something similar for the entire state that would have their own regional transportation authorities. I wonder if, in this bill, does it state where they provide a new tax or a new fee or institute a new fee to pay for the new transit for this, for Baltimore City?
I think it's more like an oversight board. It's not really authorizing like a specific transit project that they're doing.
Oversight of what in particular?
They're doing oversight of core transit services as defined under the bill in Baltimore City. So that would be Baltimore area local, local bus, light rail, metro subway, and paratransit.
Instead of being the state agency MTA, it has oversight of this new board, right?
I believe so.
So this new board replaces MTA in Baltimore City?
It replaces the Baltimore Regional Transit Commission.
Oh, good for Corey.
BRTC.
Yeah.
Gives them more power too, though, doesn't it, from the RTC?
Mm-hmm.
Other questions, Senator?
Last question, does any other county or jurisdiction have authority over their transit?
WMATA. We only have two in Maryland. We have
WMATA and MTA, right? And this would be number 3. Right? This would be number 3.
Yeah, but the counties don't have,
It would replace the way MTA operates.
Correct, right?
but the
Okay.
counties don't have authority under WMATA, over WMATA.
Yeah, we don't, yeah.
Right, that's what you asked.
Correct, yeah, we don't have authority over WMATA.
That is their own.
It's their own board, and we have like a member on the board from Baltimore, from Montgomery and Prince George's that we
Remember, this was the bill that Mike Kelly came in from the Baltimore Metropolitan Commission, and John Lario, who does a lot in development and redevelopment, they were at the table together.
Yeah.
I think they're trying to give MTA, we're trying to give that system more teeth. I think. That's the sense that I got from the testimony. Senator Gile, let's do you next.
Yeah, thank you, Madam Chair. Lisa, I just wanted to go back to the tort cap question. So I was looking at the testimony that was submitted, and so in the original bill, it had a cap of $400,000 per claimant for injuries, and so we've taken that out. Is that right?
So in Senator Hayes' amendment, he's proposing taking that out.
Okay.
The House amendments did have that in there, and they had an added paragraph in there specifying that cap didn't, I'm trying to find the exact wording, but it didn't affect So it did not limit or impair the application of 49 USC 28103 or the administration's obligations under agreements entered into pursuant to that provision of federal law. So there is an exception, but the cap at 400,000 still stands in the House amendments.
So other than, I mean, I was just reading about the history of the waiver of sovereign immunity, and are there, what other state agencies, if any, don't have a liability cap? And I'm just thinking about it in the context of, while I understand the need for compensating certain individuals for injuries arising from incidents, I mean, I do have some reservations with some of, and just in the context of, as we've talked about before, about the sexual abuse lawsuits against the state and the exposure of liability that may be caused onto the state. So I guess what my question is, as far as other state agencies, do they all have, if they waive sovereign immunity, if they have it in the Maryland Tort Claims Act, right? Isn't that what it is? Do they have a cap? Is it only MTA that doesn't?
I would have to look into those sections. I'm not sure.
Okay. Okay. All right. Well, thank you, Lisa. Appreciate it.
Yeah, thank you. Just a clarifying question. There was, I think in the original or an earlier version of the bill, section 11-203, something about Division 2 not applying to Maryland Transit Administration capital construction projects and existing and defined fixed guideway systems. Is that out of this version?
So it is out of both versions as amended. Senator Hayes' amendment would just strike that provision, so they would be required to fulfill the procurement process. The House amendment struck that provision, but then went into certain individual provisions of this procurement law and exempted them from those specific provisions.
Okay. Because I know I think the comptroller and the treasurer's office had issues with that line. And so in Senator Hayes' version, that should be okay then. They're going through the full procurement requirements. Okay, thank you.
I heard from the comptroller today, she liked that amendment better from Senator Hershey.
Thank you, Madam Chair. It is a little difficult to try to decide on both amendments. I mean, at this point in time, the bill's just truly in our hands. We don't have to agree with, obviously, the House. But in asking about what I'm actually looking at in the reprint for the Hayes amendment, is that the entire bill now? Or is that, so it's much different than the amount of pages that are here? I mean, has that much come out of it that we are?
They put that much in it, the House.
That's what I'm saying. So the House put a whole bunch more in it that,
And
okay.
a lot of it was double drafting, though, like where there was language that they had to put in. They had to put the contingency in saying, here's all the sections if this bill fails, here's all the sections here. So a lot of it is just the same section multiple times, but.
So they expanded the bill, and this is
Yeah.
just more some amendments that deal specifically as the bill was introduced. All right, you mentioned rail authority, right? Is this, and I'm just trying to find out, is that the actual terminology? Because generally speaking, in the Department of Transportation, an authority has, as Senator Washington was starting to talk about, tax and fee responsibility. So when you look at the other modals of transportation, they're all essentially administrations or departments. You look at the Maryland Transportation Authority, that covers all the tolling facilities, and they can, through their board, implement change and raise tolls and fees. So is this the way it's amended? I'm just going to refer to the Hayes amendments. Does this have an authority that would allow them that type of power? Do you know when you talked about rail authority? Was there anything, is that the intention of being able to change or do anything with fees? and maybe it's just the terminology that you used when you said rail authority, but I'm all for, having locals provide, some advisory type of role when it comes to the major transportation projects that are, in their areas. And we did this several years ago with the Chesapeake Bay Reconstruction Commission that is both Queen Anne's County and Anne Arundel County, and made sure that citizen-based type of group can understand what's going on with the bridge and the structure and any type of changes, especially as we were looking at potentially a new crossing. So I'm trying to still find out what this does with respect to reform and what it takes away from MTA and what it provides to this new entity that's here, because if it's making decisions about procurement and maintenance type of projects without having access to or be responsible for the fees or revenue that pays for it, it's hard, I think, to pull that outside of the Department of Transportation. That's just the concerns that I have right now as we're trying to decide between both bills. Thank you, Madam Chair.
Made it clear as mud.
Yeah. It's confusing.
Yeah. So, colleagues, this product is a result of a work group who's done an extensive amount of work. I was not familiar with the work group until actually they were sitting up at the dais and explaining this end product. I think some of it may even go beyond the recommendations of the work group, which is concerned. It's a lot to digest. I think there is a great deal of will in Baltimore to have more local control over what's happening as far as the transit system. And I think this is another step towards that and providing this kind of advisory board. But I still don't completely understand all that it is to do. And so that's why I'm a little bit hesitant. But some of the things that, and immediately during the hearing, I emailed Lisa and was like, hold on, the procurement thing seems like a tad bit overreaching, right? I hear Senator Giles' concerns around the tort claim, which the tort claim thing in the reprint is not taken out, but we are talking about eliminating that, right? As far as my amendments,
Yeah,
we
it
would
was
take
not.
out.
It was not taken out in the reprint of your amendments, but it is your intention to take it out.
Correct.
I understand.
Right. So colleagues, on page 15, lines 5 through 6 will be taken out, although it's not taken out on the reprint that's in front of you. And then lastly, I think, the country has a history of, condemnation, taking people's property and things of that nature. And so I don't think that was the idea around creating this new authority. Is just an add-on to giving extra authority to other parts of MTA, which I think we just need to think about a little bit more. And I haven't been able to digest all that this authority is supposed to do, but I do recognize that there's a need to have greater local control. And so with that, Madam Chair, I'd like to move favorable on the version that we have in front of us that says Senator Hayes amendments with the addition of making sure that we strike lines 5 through 7 on page 15.
I'm sorry, which striking what?
Take the one that says Senator Hayes amendments, go to page 15.
We're striking the tort
strike
cap.
the tort cap, 5 through 7.
Okay.
That's a,
So we're striking that, the removal
Right.
of that. I'll second your motion.
okay, so we,
Based on now making a decision that we're going to just go forward with this, and I appreciate this, and probably you should have gone first, to be honest, and explain the bill that you're very familiar with. But can we hold this until tomorrow to now that we're looking at, knowing that we're really just going to look at one and not the other? Would that be appropriate?
I withdraw my motion.
Okay, thank you very much.
okay. And that brings us back to my favorite bill, Senate Bill 623.
Move favorable with amendments.
What does the bill do?
Doesn't matter.
She doesn't care.
With Senator Washington's amendment.
Thank you.
Well, there's some other amendments offered.
Oh my God. Of course there are.
Should I just walk through the
Ticket.
should I just walk through the amendments like they're new, just so we are all on the same page about what's in there?
You've got 45 minutes, let's listen to Mr. Washington.
Okay.
They won't start without us.
So, in this version of the amendments, the language about Division 2 is taken out, the language about regulations is taken out. So now if this bill is enacted, the locals can, I mean, I guess they can issue it now if they want, but the locals can issue without.
Hear anything you say.
I'm sorry. So under this version of the bill, the language about Division 2 has been taken out, the language about adopting regulations has been taken out. So now the board, or the local licensing boards can issue the license without taking any sort of, passing any sort of additional statute or ordinance or regulation. This just authorizes the issuance of the license. Since we took out the part about regulations, we did have to tweak Senator Washington's language a little bit. Instead of saying they should adopt regulations to consider those factors in issuing a license, instead, it's on the back of page 2 where it lists the factors that they should consider when issuing a license instead of the factors that they should consider in adopting regulations. And then the social equity applicant definition that was taken from the cannabis provisions is also in the definition to reference back to that as a factor for issuing the license. We have the provision there prohibiting tobacconists from having a commercial kitchen. We have the provision about new CPCL licenses not being within 5 miles of an established license. Yes, no live entertainment. They're authorized to sell alcoholic beverages under the CPCL license as long as the person purchases and consumes a premium cigar or pipe tobacco while they're there. They have to submit detailed specifications for air filtration systems and exhaust systems. An employee must sign an acknowledgement enumerating the dangers of secondhand smoke and acknowledging that the employee will be subjected to secondhand smoke. It specifies that that acknowledgement does not waive any of the employee's federal, state, or local workplace safety rights. It requires a holder of a CPCL license to submit a statement of average daily receipts and an affidavit to a certified public accountant stating that they've met the requirements of being a tobacconist. That's that requirement that they sell, that 70% of their sales is the premium cigars and pipe tobacco and related accessories. In the next provision, the license holder is prohibited from allowing people to use cigarettes, electronic smoking devices, or cannabis on the premises. It prohibits individuals under 21 from the premises and prohibits live entertainment. And we have the license fee set by the local licensing board between $500 and $2,500. The next part is, I included some existing statute, but this section of the alcoholic beverages article specifies that a person or local licensing board may not issue more than one license for use at the same premises. So I put that in there to address some of the concerns we had about whether the tobacconists could go acquire a different class of liquor license and then be holding multiple licenses. It seemed like we wanted to make it clear that they could only sell alcohol under the CPCL and they couldn't get anything else. So next part is about the BYO provisions, that those are authorized if the local licensing board chooses to authorize those. And in those cases, the owner and operator of the tobacconist has to comply with certain requirements, such as they can limit the types of alcohol, the employees need to be trained in alcohol awareness, there's certain hours, and we also prohibited cigarettes, electronic smoking devices, and cannabis in individuals under the age of 21. And the local licensing board does need to notify ATCC if there's a tobacconist that is allowing on-site consumption, just so they can kind of track that. Next is the provisions about the tobacconist that are amended to specify that they have at least 70% of their revenue from premium cigars, pipe tobacco, and related accessories. On to the next page, that requires them to submit the plans about air filtration and exhaust systems. And then there's also the provision under E4 that was added in specifying that they can only sell alcoholic beverages if they hold the CPCL license. The next page, they're prohibited from sharing a wall with a licensed healthcare facility or childcare facility, but they are allowed to renew their license if they had a license and one of those facilities moved next to them. When renewing a license to act as a tobacconist, they're required to submit the average daily receipts and the statement of the public accountant showing that they met the definition of tobacconist. And then the uncodified language that we put in about the conversion, specifying that all the licenses that are currently eligible would be converted, that they have until 2028 to comply with the requirements about the 70% of sales. And then I did separate C out a little bit clearer to address Senator Jackson's concern about the total license cap. So I split those out into two items to say that the converted licenses count both towards the amount of CPCL licenses issued in the jurisdiction as well as alcoholic beverages license caps in the jurisdiction. So that's at the uncodified language at the very end of the bill. And C. Yep. It's C2. And there's still the provision in the codified language that was specifying that they counted towards the total count when they're issuing new licenses as well.
So I move favorable.
Senator Washington has a question.
All right. Thank you, Madam Chair. Just a quick question. I know we're doing this 75-25, right? 70-30. If for any reason it teeters one way of it being 45 or 50% of the alcohol sales potentially, what happens then to that business? What's the fine? What's the, what happens if
They
it?
have until July 1 of 2028, I guess, to come into compliance, Lisa, is that what
If it was issued already,
Yeah.
and then 4 or 5 years later, you learn that they're 50-50 with the license, what happens
That would be up to your liquor board,
to determine? But
yeah.
Well, they have to submit the statement with their license renewal, so I guess if they didn't meet the threshold, they wouldn't be granted a renewal.
we don't specify that here, but under this bill, because we took out regulations, does it allow for the liquor board to promulgate regulations concerning this this topic or any other topics?
Well, the definition of tobacconist would be in statute, and that's where that 70-30 comes from. So I don't think they wouldn't be able to enact any sort of local regulation or ordinance that would conflict with that, because the state law would supersede at that point.
So now you're saying,
What you're saying is, let's say they have 40% receipts.
correct,
What could the liquor board do about them not being in compliance?
correct.
What do they do now when someone's not in compliance? Like what we do in Anne Arundel, I can talk about Anne Arundel, you're not allowed to drink in the parking lot. If an inspector catches you having drinking in your parking lot, they bring you in for a hearing and make a decision whether they're going to fine you or take your license. So I don't know if that would apply. For instance, if they broke this, this is a regulation that they have to obey, and if not, they'd be whatever your liquor board does when people are not following the regulations.
And specifically for the CPCL license, they are required to submit those statements annually. So I think that
To the liquor board or to?
they are submitting those to ATCC and the liquor board.
Got it. So, but we have not given the ATCC the ability to shut down stores if they do not adhere to laws yet. They don't have the ability to stop them. So then would it be the liquor board that would be able, based on their local regulations, will they be able to shut them down or stop them or not renew their license?
Well, under the law, the local liquor board, I assume, would be able to, because they're not in compliance with the laws.
Look, my liquor board is very different. And yes, and they don't like to go. They don't like to. They don't promulgate a lot of regulations. That's why I bring it up a lot of times here, because they look to us to provide them with the guidance on what to do in certain circumstances. And so that's why I've been really prescriptive about some of these things of considerations, because like I said, when I went to them and asked them how would they issue these licenses, they said, we'll give it to first come, first serve, because you guys are not giving us criteria on how to do this and so on how to implement this. So my concern is that I would like to develop something. I'll think about that later once they happen. I can think about that. Yeah, it will. But I want us to think about that though, because a lot of boards look at our laws and see what's on the books before they make a decision. And if we're not clear about them, of our intent, then they just allow these people to keep doing what they're doing, unfortunately. So.
Yeah, there are no penalty procedures or procedures specified if they're not really.
There's no
compliant
penalty.
from the bill.
There's no penalty procedures. There's nothing in there.
Would it be in our Prince George's County part on the liquor board with? I will tell you what happened in my county. These two cigar stores that we didn't know about, they did have a 70-30 requirement that my county, when they passed this bill, they shouldn't have passed, but no one was enforcing it. And we found out about it, and now they have to submit audited statements, but it took.
But now even so, there's no fines, even if they still continue to do that, even if we do pass this law.
Yeah, I don't know.
There's no fines associated with it, penalizing folks to
Does that seem like a problem?
It could be.
I would think so.
Don't get me in your mess. I'm done. I would like for us to think about that.
ATCC is saying that if they don't have that 70-30 threshold, at that point, they no longer meet the definition of a tobacconist, and then the board couldn't renew or issue the license because they can only issue it to a tobacconist.
They just told you that.
So there are ramifications then?
Well, I mean, they
for it
wouldn't
then, basically.
Yeah, but I guess it would be up to
They're
the
not
discretion of the liquor
penalties.
board to actually enforce that and shut them down at that point, you know.
Yeah, and our board
Yeah.
does not shut down anyone for it.
Well, the ATCC could also, right?
Yeah, or they don't? No. Just the locals.
They just can't have a license. We would enforce that. Senator saying his local board doesn't do much enforcement.
I had some good bills.
Yeah.
When does this bill become law?
July
27?
26.
No, it's
because-
emergency. Is this an emergency, though?
No, but because there's,
It's a moratorium.
because there's already stores operating, we're doing something that is enforcing what the current liquor tobacconists are doing.
So then we make these licenses available immediately, once the governor signs this bill? July 1st. Oh, so it's not emergency. I was trying to. July 2nd.
Yes, thank you, Madam Chair. One very generalized question, and then I'll get to a more specific question. Will liquor boards have the ability to require all of the things they currently require before approving a liquor license? For instance, the community input, the hearings, what considerations there are for other alcohol that is close by, or is this going to prohibit our liquor boards from being able to apply the same requirements they would in issuing any other liquor license?
Like 1,000 feet from the church and all those kind of regulations.
whatever it is that they have, that they require, and the public hearings that they hold and the objections. If you have the community come in and 99 people say we oppose it and nobody says we want it, can the liquor board then deny it, or must this be approved?
Yeah, so under this, the board still does have the discretion to issue the license. It says may, so they don't have to issue any if they don't want to. And I guess this is kind of setting like the ceiling of what they can do, and if there's a local regulation or process they have to do that doesn't conflict with what's in the bill, then that they would be allowed to do that.
All right, then the more specific question I have is, were no amendments prepared to allow jurisdictions to decide if they would like to participate in this process?
I did get one that I don't know if another, if they were going to offer it, or I was, that exempted 2 specific counties. Is that what you're referring to?
It is not. I was
Okay.
originally, I thought yesterday we agreed there would be an amendment that would address this process as we do the other, and I didn't want to get into a debate as to whether I had the proper language for it, but simply the same process that we abide by every time a barber shop wants to come in and get alcohol. I thought that's what we were going to do, but if we have not prepared that, am I correct, it was not done?
I think the chair.
But nothing requires a liquor board to issue a license.
No.
I mean, they don't have to issue
Okay.
any of these licenses. Why would they?
In that case, I would ask that the committee respect those of us who are not, and I will share with all of you, I have not had one individual or business come to me and say they support this bill. I have had dozens in opposition. So this is not something Montgomery County is clamoring for. And I would ask then that, since there appears to be a particular jurisdiction that is very anxious to have this, I welcome the fact that they can have it. But I am going to ask that Montgomery County be exempted from this bill. And if Montgomery County at a future point in time says, we would love to have alcohol in our tobacco shops, then we will like to move forward with that. But at the moment, I did not have one single constituent or business interest, including the cigar shops, say they support this. And as I said, I've had dozens come in opposition. So I would ask that we please honor the wishes of those in my county who have zero interest in this and not have it forced on them, and exempt Montgomery County. And let those jurisdictions that want it, God bless, go forward.
Do you think you should have a vote in your delegation for that?
I'm confident if I did, I know exactly what the outcome would be. And if you want to hold the bill, Madam Chair, I will pull the delegation tomorrow and I will ask them to vote.
I would feel better if you did that.
I mean, historically, I have found that generally speaking, when you have a representative of a county on any one of our committees, they do defer to that member of the committee speaking on behalf of their county. And I have respected that in the past when I have someone from Prince George's say, this is what we would like. My colleague from Baltimore City just now on a bill that he had, and I respected that, and therefore I gave it, I'm in full support. But if in this case you would like to hold the bill, I will reach out to the Montgomery County Senate delegation and seek their input.
Let's say we take his word for it.
No, it's just you're excluding an entire business opportunity from your county. Just seems like.
For which there's been zero support, Madam Chair. I've not had one, the Montgomery County Chamber of Commerce did not come to me in support. Not one tobacconist supported it, but everyone that has reached out to me said, no, we don't want to be in the alcohol business.
Am I wrong asking for a letter?
Not at all.
Okay. Not at all, not at all, I'm not wrong.
You are not wrong at all.
Then let's hold the bill
Okay.
and
Let's
give me
finish
the
everything
opportunity.
else, Okay, let's finish everything else, and then we'll just wait for your letter, and tomorrow we'll vote with your letter that you're gonna get. Absolutely. Senator Lamb?
Yeah, I mean, no surprise, I have the same concerns. I've not heard from any cigar shops and tobacconists in.
They are
our county.
operating in your county. The chairman of B&T confirmed with me, not only are they operating in your county, he goes to them. So you do have them operating, and I asked you to
But I
find that
haven't
out.
heard any cigar shops that want
Well,
this.
they're operating
privilege to
in
be
your
able to do
county,
it.
so you cannot exclude them if they're already operating.
All right, I will check, and
You told me
But I-
yesterday you were gonna check with your liquor board,
I just haven't
but
heard back.
I walked back with your chair, with the chair of B&T today. And I can guarantee you they're operating in your county.
Okay, I will check.
Senator
and
Hershey?
Look into that.
I think sometimes, Madam Chair, when we look at statewide legislation, we have to look at it from that perspective. I mean, I would love the opportunity to have been able to provide a letter from my county saying they don't want solar development on the Eastern Shore. Was not allowed to do that. So, again, I recognize that these are licenses that the counties do offer. I think it should be up to them. If we're going to pass statewide legislation, we should keep it that way.
Senator Washington?
Yeah, in the since we're holding it, I would like for Lisa to help us out in developing the language that points to penalties within our own jurisdictions of what it would be if they do not abide by the law or do not adhere to the policy, that they can be revoked or fined or anything like that. Because right now, I just want to make it clear that those penalties are subject to that of the jurisdiction, subsection laws, whatever it might be.
Lisa's writing.
Thank you.
So you'd like them to be, either have their license revoked, non-renewed, or fined,
Or
or?
whatever the local law says what it is, yes.
Okay. All right. So we're not voting the bill today. We will vote it tomorrow based on, I would prefer if there's any other amendment ideas, we get them out now, because tomorrow is the last day we're voting. If we don't vote it tomorrow, it is not going to get out of crossover. Are there any other ideas for amendments, requests, discussions, suggestions? All right.
So, Madam
Senator
Chair,
Hershey?
I would agree with you. With respect to that, I mean, again, we've got competing reprints. One does clearly just say that it exempts Howard and Montgomery counties. Is that the one we are going to work on then? No.
We're not going to exempt Howard County because they're already operating.
Right.
If we get a letter from the Montgomery County delegation or any other delegation that they want to be exempted, we can do that tomorrow.
Okay, but that's what I'm saying. So the rest of the bill then is, we're going to keep it the way that this draft has, this reprint
Yes.
has. And we're working on that one. Okay. All right, well, good. Well, I like it.
Which one's which, Lisa?
So the one that is the chair's amendments is 493820. Should say 31926 at 11:20 a.m.
Okay, thank you.
Yeah.
That's not this one.
Okay. So it would be, yeah, it's the other one. Yeah, it's not that one, it's this one.
So this is what we're going to do then?
Yes,
And then potentially add Montgomery.
potentially.
We're going to do all this, and the House is going to come in with a completely different bill. Yes, sir.
Thank you, Madam Chair. In the vein of, providing ideas, Lisa, can you tell me if we're doing 150,000? Sure. If we're issuing one of these licenses per 150,000 per county, how many licenses are there statewide?
Well, there's at least one for every county.
Correct. Yeah. Okay.
We'd have to take the population.
I just wondered. I wondered if somebody did that calculation already. If not, then that's fine.
That is too much math
My
for
county
me.
has like 570 people, 1,000 people. We
Yeah.
already have 2, so we have one more license.
I say that because there's, there could be 40, 50 new licenses in the state. In Prince George's County, we're considering a piece of legislation where we're phasing in the number of licenses instead of it being all at once. There's 2 every year. There's no more than 2 that can be issued in the calendar year. And so instead of it being just all at once, and we can exempt the ones that currently exist But if there are new ones, there could be no more than two authorized per calendar year to phase it in, so it's just not one hit. In Prince George's County, there will be about 7 of them available for us, which is a lot. And so if we phase those in, similar to another piece of legislation that we're doing, I would think that'd be great for my county, any other county that has it, but exempting the ones that currently exist, like Baltimore City or even your case, I think it'd be good to have.
So,
No more than 2 per calendar year that could be issued.
so that's an amendment?
I would like that amendment, yes.
Okay. Anything else? This is another bill that Lisa's worked really hard on. Amber's had a number of big bills. My little crematory bill that turned into 56 pages. Okay. Anything else for the good of the order? You have 18 minutes to the floor.